Hi there, this is Gist Nigeria coming up on the program. COVID-19 vaccination. Mixed reactions as Nigeria set December deadline for federal civil servants to get inoculated. Also, left-handedness. Experts caution against forcing transition from natural handedness on children. Plus, looking good. Imported fast fashion fuels environmental pollution in Ghana. And
hello, my name is Udiri Biti. Check me out.
The makeup artist creating soft glam and natural beauty looks. Welcome to Gist Nigeria from the BBC and Channels Television. And here on the program, we track the stories making the rounds on social media. I am Wale Fakile. Let's start with our top story. From December the 1st this year, federal civil servants who have not been vaccinated or present a negative COVID-19 test result will no longer be allowed into their offices. Since this was announced by the federal government, it has been a subject of fierce debate among Nigerians. To some, such directive takes away individuals' power to decide over their body, while others say protecting more Nigerians from contracting the virus is more important. But will enforcing vaccination of federal civil servants make any impact if many Nigerians continue to flout established guidelines against contracting COVID-19? Is this a smart strategy? And does Nigeria have enough doses to go around? Gist Nigeria's Aneta Felix has the answers in this report.
Civil servants going in and out of their offices at the Federal Secretariat in Abuja. But this unrestricted access will soon be halted. From the 1st of December 2021, all civil servants here and in the entire country will have to comply with a new no vaccination, no entry policy. Chairman of the Presidential Steering Committee on COVID-19, Boss Mustafa, announced on October 13th that federal government employees must show their COVID-19 vaccination cards or a negative COVID-19 PCR test done within 72 hours to gain access to their offices. Representing Nigerian workers, President of the Nigeria Labour Congress (NLC) agrees that vaccination is important in the fight against COVID-19, but persuasion and not force should be the rule of thumb.
Yes, it is important to encourage our workers to take the immunization, but importantly, I think globally, it has proven that when you use force or coercion, then the hesitancy will go higher, and then the tendency is that people will have vaccine hesitancy, just as in the case of polio, where we have used persuasion, conviction, and then people are now taking it willingly.
At a media briefing in Abuja on Thursday, October 14th, Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, explained that public health experts advised the government to make COVID-19 vaccination and testing mandatory. He said this was to ensure that the work environment at all federal government institutions is COVID-19 free for the public good. Legal practitioners don't agree. In fact, Monday Ubani, chairman of Nigerian Bar Association section on public interest and development law, describes the order as illegal.
Has there been any law that passed through the process of legislative enactment that has been made today in Nigeria that has made vaccination compulsory? And if you ask me, there is none. There is no law that has been made, both at either at the state or the federal level. There was no discussion, there was no lawmaking. They don't take into consideration other people's argument, and they say, go, and without it, you can have access. And I think that is not proper.
Ubani has given a pre-action notice to sue the government if they do not engage Nigerians and rework the vaccination order. But public health expert Dr. Sonny Phillips tries to make a case for the government.
People are still gathering in large number without the requisite protection or face mask of social distancing. There are still a whole lot of Owambe ceremony taking place every weekend. And where other measures are failing, the ones you can control, you may need to mandate.
Indeed, a look at major Nigerian cities hardly paints a picture of a country in a pandemic. Markets are crowded with shoppers, buses take on passengers at full capacity, and BRT parks are filled with too many people with too few face masks in sight. Yet, public reaction to the government order is a mixed bag. While some Nigerians give the directive a nod,
they are looking after your own health and after the health of the workers.
It's okay, they should go about it and take it.
I think it's a good idea. So at least we will encourage some people to go and take the vaccine.
You rather stay away from government work if you know you cannot take your vaccine.
Others describe the mandate as a human rights abuse.
Government have no right to force someone to do what he or she does not like. Me, myself, if I like, I will take it. If I like, I will not take it.
Oh, it's my body. Nobody can force me to do what I don't want to do with it.
These sentiments are perhaps a result of the controversies still around the efficiency of the vaccines globally. But in a statement on the website of the National Primary Healthcare Development Agency, Executive Director Dr. Faisal Shuaib played down some of these worries. Dr. Shuaib says the safety of the vaccines have been proven in a study conducted in 6 states. He adds that Nigeria has enough vaccines for federal civil servants and that plans are underway to set up mass vaccination sites across the country. All attempts to get comments from the MPHCDA on whether the test will be free for civil servants and the frequency of testing proved abortive. Waba, however, says the agency has clarified that it will not force workers to take the vaccine.
I don't think there is any statement in what I've read and also from what we have confirmed from National Primary Care Development Agency, because they were here this morning and they said, no, that wasn't actually to force everybody, but is to persuade people and also to get them convinced that the vaccination is the way to go.
In September 2021, Edo State put the order to the test. Unvaccinated civil servants were locked out of their offices and news began to spread of the alleged sale of vaccination cards in the state. There are concerns that these allegations could become nationwide if the federal government's order is implemented. But the NPHCDA has threatened to work with security agencies and punish all who buy or sell vaccination cards. For now, COVID-19 vaccination remains voluntary for the wider populace, but civil servants in Nigeria might soon be compelled to play by a different rule. The jury is still out on how this will impact the fight against coronavirus in the country. Annetta, Felix, Gist Nigeria.